makes the conversations like this possible. So my name is Dr. Yvette Edgehill Spano, and while my background is in mucosal immunology and vaccinology, or the study of vaccines, I want to be incredibly clear that I am not a medical physician, okay? And the information I'm sharing with you today is drawn from public health and environmental agencies, including the Center for Disease Control and Prevention, which is the CDC, as well as the EPA, the Environmental Protection Agency. So, with that, today's focus is on what are called PFAS, which stands for, and please forgive me, per and polyfluoroalkyl substances or chemicals. And these are a large group of human-made chemicals that have been used for decades. And these products are designed to resist heat, stains, water, oil, and things that were developed from that are like non-stick cookware, firefighting foams, food packaging, and there's certain textiles that they're incorporated into. Because PFAS break down so incredibly slow, they persist in the environment and eventually they accumulate over time. That leads us to give them the nickname forever chemicals. So in this talk, we'll explore what PFAS and PFAOs are and how they move through our environment, as well as what research says about their potential effects on human health and our ecosystems. It's my goal to provide a clear overview that empowers you with knowledge and encourages thoughtful community dialogue. So, with that, I'll begin the talk as PFAS and PFOS, know your exposure and protect your health. So, what are PFAS? Well, believe me, it was surprising when I was doing the research on it. It was surprising to find how many and how much is out there. And there are over 12,000 synthetic chemicals since the 1940s in industry and consumer products, and they're made of the carbon fluorine bonds, which are the strongest chemical bonds in nature. So you know they're not going to be going away anytime soon. And they persist indefinitely in the soil, in the water, in the human body, and that's why they're called forever chemicals. Now, PFAS is detected, believe it or not, worldwide, such as Arctic ice, ocean fish, rainwater, and in human blood on every continent. Now, that blew my mind. That really blew my mind. And the most chemicals that are studied are the PFOAs, which is perfluorooctanoic acid, and PFOS, perfluorooctane sulfonic acid. So, yeah, we're dealing with something here. And the most studied PFOS are the most studied chemicals. And so, what was surprising also, now I have a lot of surprises, okay? So during this talk, what was incredibly surprising is the origins, which was Scotchgard. We all know Scotchgard, and the firefighting foam. Wow. And it was phased out in 2002 when they realized that it was being found in various places, which they didn't really expect. So its half-life right? The half-life in the human body is 5 to 8 years. And then that accumulates, and you'll see where it likes to go. It likes to go in the liver and blood proteins. Primary exposure route is important because most of our contamination is through water, drinking water. And and for some strange reason, they're normally found or can be found within the nearby military bases. And it accumulates not only in humans, but in, like I mentioned before, fish and wildlife. And the highest concentration is in your fatty fish from affected lakes and rivers and coastal waters. So, fatty fish, what does that remind you of? Salmon, salmon. And what I thought was really interesting is that these forever chemicals have been found in virtually 100% of Americans tested. That's huge. So, guess what? These things are hiding in, these chemicals, forever chemicals, are hiding in plain sight. Look at your cookware and things that are for packaging. We already mentioned the firefighting foams and textiles and personal care gear and equipment. This is everyday stuff, particularly for the firefighters. So, that says a lot about what we use these chemicals for. But now we're finding out the impacts that these chemicals have on the human body as well as in the environment. So, the roots of exposure, believe it or not, is number one, we mentioned the drinking water, then what you eat, the food consumption, mentioned the salmon. Inhalation. Depending on where you're working, there could be some that are contaminated or dust particles that you breathe in and it's contaminating you. The soil and dust ingestion, particularly for young children, and then prenatal and breastfeeding mothers. Because these chemicals can cross over the placenta, what is called the placenta barrier, and they can cross over through the spinal cord the into the breast milk as well. And so the children are especially vulnerable to this. The scale of the communication of contamination, I'm sorry, for, in America, 98%, approximately 98%, which is very close in my mind to 100, of individuals in the US, Americans, can detect it in their blood. There are over, and we mentioned this before, over 12,000 chemicals that have been identified globally, and 85% decline in the blood has occurred since 1999 to 2000. That's just 1 year. And I tried looking for further years, and no, they don't. I couldn't find very much about that. And so once it became aware, the industrial uh, individuals, companies, once they became aware of what was happening to their workers as well as the environment, then they cut back. They cut back using these chemicals in some of the products that they use. So over time, they saw a 70% decline in the blood, according to the CDC. Now, 9% of the Americans have it at a very high, elevated clinical threshold. And again, that has to do with exposure, such as when there's the firefighters, they're always with that foam. They're getting a large dose every time they use it. So they fall under that category. And believe it or not, 45% in our tap water is contaminated with at least one of a forever chemical. So This is just a brief overview of some of the effects and its evidence-based findings on what forever chemicals do to you. So you can have elevated cholesterol, and you see where they have sufficient evidence, and then you have limited evidence. So for sufficient, elevated cholesterol, reduced antibody response in children. Right. So when they get a vaccine, they may not respond the way they need to. So when the bug comes, virus, but whatever, they cannot respond to it because they haven't built up the antibodies that protect their bodies. The decreased birth weight, kidney cancer, as well as pregnancy-induced hypertension and preeclampsia. Those are some of the things that we seriously hear about from day to day. Now, where they're also looking to see where the effect is, they have limited information or evidence on testicular cancer, changes in liver enzymes. Now, the liver enzymes is really important. The liver in itself is very important for helping clear your blood, and thyroid disease and dysfunction, breast cancer, and ulcerative colitis. So these are some of the areas that if you're experiencing that, then I would suggest you see your physician. So who are at risk the most? Of course, the infants and young children, the pregnant mothers, the occupationally exposed workers, as I had mentioned, the firefighters, an example, and communities near contaminated sites. And what I found interesting is that the higher readings are if you are near a military installation. For some strange reason, surrounding that installation is where there's high levels of contamination for that, right? Now, as I said, I am not a physician and I cannot diagnose anyone. What I can do is direct you or try to direct you to who you need to see, the medical specialists that if you feel that you're exposed or your family members or people that you know are exposed, these are the individuals that you should try and see. You can mention it to your GP, your primary care physician. And the one thing that's really important is documentation. You have to document where you believe the exposure was, when, how many times, and some of the symptoms that you're experiencing. That's credible because what happens is they have to have that information to see, okay, we have to now move it to the next level if we find that there is elevated and getting the blood test as well. You can't just go to your regular site, I guess, and just say, okay, tell the doctor to draw these things. No, there's specialists that you have to see to be able to be checked and tested. So the primary care, you go and you let them know. They can refer you to any other physicians that if it seems to be organ directed, where there's an issue and you believe that it's due to your exposure, then they can find individuals that can do that, such as a nephrologist, right, for your kidney, an endocrinologist, which is dealing with the thyroid and hormones, and cardiologists if you're having issues with your heart, and for OBGYN, that's hands down. You absolutely need to let your primary physician and your OBGYN official know, physician, sorry, your physician know that you have been exposed. And then they can take the next steps as to what is happening. But again, please have your documentation with you. And then the oncologist and urologist, if there's cancer that develops, such as a kidney cancer or testicular cancer, then these individuals will be the ones that you would go to for that assistance. But always remember, you should go to your primary care physician and let them know, along with your documentation, what it is that you believe you're exposed to and for how long and where you may have had that exposure. And that way, they're not working at a no playing field and you have to start all over again. You don't want that because that's going to delay getting you the proper care that you need. And next, one of the things we have to think of is prevention. How can we prevent it? Some things we can't because, for instance, some companies dumped into the environment their chemicals. We can't prevent that. There should have been a way to get them to clean up what they did. But that's a whole nother story, and I don't want to go into that. So test your drinking water. There are kits you can find, and there are companies that sell them. You can even have someone come into your home and test your water for these chemicals. You can also stay away and reduce your use of these high risk products, such as Teflon pans. I mean, the recommendation is to use the cast iron pans, pots and pans. I know they're really heavy, but guess what? They're healthier for you. They're healthier for you. And you want to be mindful of being near a contaminated area for extended period of time. That's important. And as I said before, you want to talk to your physician. Let them know what's happening. Let them know if you feel that you have been exposed to something and how you're reacting. And believe me, I know and I understand that some of these exposures happened decades ago. Decades ago. I understand that, but it's still important. I'm sorry, no, but it's still important to say, this is when I was exposed. I worked for this company 20 something years ago, and these are some of the chemicals that we had to work with. That at least gives them a benchmark, a foundation as to what they need to test you for and the chemicals that they need to test you for. And then the other thing, um, attending gatherings like this, attending places that are speaking about the environment, speaking about contaminations, speaking about health care in living in residences, and we know what those are, that have higher levels of contamination than, someplace on the other side of the street, I'll say. And the thing is, the more you know, the more you learn about it, the better off you and your family and your friends and your neighbors will be. Please don't keep it under a basket. Sorry. Don't keep it under a basket. Please let them know and be prepared. So, with that, what I want you to remember is that these PFAS, they are everywhere. They are everywhere. And we talked about some of the risk who are at high risk and what your blood levels can be, as well as the power to decrease your exposure. So, with that, I want to thank you and Dr. Wakefield and the Green Church for having the opportunity to present this information to you. So, this resource page has some information, and hopefully we can share this later. So, with that, I would like to thank you for the opportunity again and have a good day.
Hello, and good morning. We're in an incredible blessing to stand before so many people who believe our future can be healthier than our past. Today isn't simply about food. It isn't simply about the environment. Today is about restoring the relationship between people and creation. And today's segment is brought to you by Creatures Eatery, DBA Kingdom Builder 87 Healing, where we believe in growing and healing oneself, but also healing the whole self. Healthy bodies, healthy communities, healthy Florida, from contamination to cultivation. The earth is the Lord's and everything in it. We're here because Florida faces chronic disease, food insecurity, environmental challenges, mental health struggles. Yet Florida also has incredible opportunities, beautiful rivers, healthy farmland, forests, springs, beaches, communities willing to make a difference. Every challenge also carries an opportunity. Today, we choose cultivation over contamination, hope over fear, and health over sickness. Please understand blood types. Blood types is determined by the presence or absence of certain antigens on the surface of your blood cells. Blood type diets remain controversial. Current science has not proven one blood type should eat one particular diet. However, thinking intentionally about nutrition encourages healthier conversations. Type O, positive, negative, but I want protein and produce. That's me. I like to eat meat and veggies. Type A is plant-based foods and leafy greens that y'all go to. Type B is balanced overall. Dairy is included, low fat though. Type AB thrives on protein balance as well, but it says dairy is in moderation and more greens and broccoli and seafood. No pork, no beef. Excuse me. Science is instead of focusing on blood type, everyone benefits from fruits, vegetables, water movement, rest, peace, community. Healing is not found in one American food. Healing happens through daily habits. Research on blood type dietitians continues. I said that already. What science does support whole mentally processed foods, regularly movement, quality sleep, and stress management. Florida's bounty, Florida's pharmacy, fresh produce, fresh Florida citrus, blueberries, greens, sweet potatoes, seafood, herbs, peanuts, local honey. Nature provides medicine long before medicine reaches the pharmacy. That nature is medicine. Research shows that time outdoors can reduce stress, improve mood, boost immunity, enhance well-being. Stress, lower anxiety, increase physical activity. God created nature before hospitals. There is healing outside. Take a walk, plant a seed, watch the sunrise. Healthy soil, healthy plants, healthy food, healthy communities. Everything starts beneath our feet. Protected Florida, protecting our health. We need clean water, clean air, which makes healthy lives. We must protect our rivers, springs, and wetlands. The Everglades should be protected. St. John's River needs to be protected. All trees, pollinators, wildlife need to be protected. If we poison the earth, eventually we poison ourselves. So I speak quickly about this. Food justice is justice served, injustice served everywhere. Um, Everyone deserves healthy food, safe parks, clean water, fresh air, healthy neighborhoods, regardless of zip codes. One thing that I am pushing for because in my city is policies that benefits growing of own foods. In my brains, I'd be like, if such feel damn what I'm gonna do, what we gonna do. So I need to make policies to reflect that time when it may come or if it's not happening or just or even in this time. But the policy is to right now the city has a policy where you can plant garden on your yard in your yard, but You can plant multiple items, but you cannot focus on one item. And in my opinion, if it comes to that, and we already in a food desert, we're threatening a food shortage, I need a whole block to grow one item. We need blocks growing the same item so that the growing and the scale of the food is at enough to supply a community. That's what I say. We gotta grow our own. We gotta take our own. Can't wait on nobody. Nobody come and save us. But God took the man and put him in the garden of Eden to work it and take care of it. That nobody coming to save us. He put the man in the garden of Eden to work it and take care of it. Our bodies, our temples, our communities, our families, the earth is our responsibility. God never asked us to own creation. He asked us to care for it. And then ask these commitments to be part of your daily life. Eat better, move more, plant something, support local farmers, protect water, teach children, volunteer, and love your neighbor. Bring home begins at home, at the dinner table in our neighborhoods, in our churches, in our schools, in our gardens. Imagine church planted gardens, every church planted gardens. Every school taught nutrition, every neighborhood planted trees, every child learned to grow food, every family spent 1 hour outside together every week. Florida will change. Our children are watching. They will inherit our habits, our rivers, our forests, our neighborhoods. Let's feed them something beautiful. Thank you. Together we move from contamination to cultivation. Healthy bodies, healthy families, healthy communities, healthy Florida. Before I leave today, I want you to remember one thing. The first environment you'll ever live in is your own body. If we neglect our bodies, our health suffers. If we neglect our communities, our family suffers. If we neglect our rivers, forests, oceans, and soil, future generations suffer. But the opposite is also true. When we nurture our bodies, our minds become stronger. When we strengthen our families, our communities become healthier. When we restore our environment, we restore hope. Hope grows when people decide to care. So today I challenge each of us to plant something, grow something, teach something, help someone, protect something, leave for the better than you found it. Because our greatest inheritance isn't money, it isn't property, it isn't titles. Our greatest inheritance is the world we leave for our children. Let's leave them clean rivers, healthy soil, healthy food, healthy neighborhoods, and healthy hearts. May we become known as a generation that chose cultivation over contamination. Thank you, God bless you, God bless Jacksonville, and may God continue to bless the great state of Florida. You can find me on Instagram or Facebook, Kingdom Bender 87, 3 Demetrius Eatery. Thank you.